Hello viewers, what are all the treatment options if fissure happens? Can fissure be treated medically? Do we have surgery the only option? Let's discuss about this. We do have a medical treatment for fissure. What medical treatment options we do have in fissure in ano is, the first thing which we need to correct is the diet. Utmost care has to be taken that the patient is not constipated at any cost. What happens if constipation happens? Just as we discussed, definitely harder the stool, greater the amount of friction that will be over the fissure area. So the stool has always to be semi-solid or soft so that the fissure area can start healing. Even if having passed soft stool for long duration, and after a long duration, if there is a single episode of passing hard stool, the fissure has to restart the healing process all from the starting, because even if it has got healed for 90%, and if patient has got one episode of passage of hard stool, already healed area will be disrupted and the healing has to start all from the beginning later. Avoiding constipation is of utmost importance. How constipation can be avoided? By having plenty of high fiber and having plenty of water in the diet. Apart from having plenty of fiber and water, he or she needs to ensure that they are having plenty of water, minimum of 4 to 5 liters per day. Apart from this, for pain relief, what all precautions, home remedies can be practiced are having a sitz bath after passing stool. What is sitz bath means? Every time after passing stool, the person needs to fill a tub with lukewarm water and can place some betadine solution or some rock salt in it, and after passing stool he need to sit in this tub for a duration of 10 to 15 minutes. How it helps? It helps in two ways. First thing is pain relief, because this hot thing definitely causes some relaxation of the sphincter, thereby promoting the blood supply and encouraging healing of the fissure wound. And the second thing, in preventing infection, because it's kind of a double level of cleaning after over the fissure area. So sitz bath is important, having plenty of fiber, plenty of water in the diet, and regular physical activity is important. Apart from this, we will be prescribing few creams which will act like a local anesthesia and few ointments which may act like a muscle relaxant, so it will cause slight relaxation of the tightened sphincter muscle. These are all the medical treatment options available which can be prescribed for people who are having acute fissure, means people who are having fissure for short durations. So what are all the treatment options for people who are having this fissure in ano for longer durations? Always there can be a trial of medical management even for people with a chronic fissure in ano, but in spite of practicing all the precautions which we have already mentioned, and after taking this medication, sitz bath, etc., if the pain is still persistent, the only permanent treatment solution for these group of people will be a surgery, what we refer to as sphincterotomy, which can be completely done by a laser approach. What we generally do in a laser sphincterotomy is, in laser sphincterotomy, the advantage of laser remains that unlike in open surgery, there won't be any cuts or scars. What all we'll be doing is a small pinpoint hole which will be made with a laser, and we'll be going inside, and the tightened sphincter muscle will be relaxed, so that now what happens is the anal canal, which was completely tightened, now becomes relaxed. So thereby this helps in healing of the fissure, and there will be drastic and significant decrease in the amount of pain after surgery, because earlier it used to be very tight. Now the sphincter has been released so that they can feel that the tightened anal canal has restored to normal now. So just because after the anal canal is restored to its normal circumference, now there will be decreased amount of pressure while passing stool, thereby the fissure starts healing. Once the fissure starts completely healing, there will be definitely complete drastic and significant decreasing in the amount of the pain after the surgery. So what are all the advantages of laser when it comes to fissure in ano is, first thing, we won't be having a big cut or scar, and the procedure is going to be completely bloodless, because the only scar or the only injury that will be happening after a laser surgery for a sphincterotomy for fissure is a small pinpoint dot. through this dot only we'll be going inside and we'll be completing the entire procedure. So there is no incision, so accordingly the pain is less, there is no blood loss, and the post-op recovery will be fast. The patient will be able to resume his activities as early as possible.